Hey everybody, it's Friday again, March the 4th. Uh, I think that's right. I sometimes work in my calendar a month or two ahead, and I was telling somebody just the other day and thinking that we were already in April. Please don't let it already be April, but it is still March, going to be March for at least several more days, so hang in there. I'm going to start with some congratulations because we've had some really cool congratulations to do this week. Tracy Thigpen, if you haven't heard, of course, won Employee of the Year, our Chief Nursing Officer. Man, this has been a really demanding year on Tracy, having to deal with all the reporting and the tracking and the calling, and the list just goes on and on. She has done a Herculean job. And like I said in my email, uh, a lot of what she had to do, I would be aware of over the weekend and at late night hours. Just an enormous amount of work that has been on her shoulders. And then, of course, we had the employee of the month, who was Daniel Myers, who is our shepherd over the uh, rural communities outreach programs, opioid outreach programs that have been so successful, and hopefully we'll be able to ramp back up into that as things under COVID become a little less stressful. And speaking of COVID, well, before I speak of COVID, I do want to congratulate the Inclusion Council. The work they did over Black History Month was absolutely amazing. I learned so much, got a couple of really good recipes, and just awesome work. So thank you. Latoya McGuinn did so much with it. Shanika Pygott, of course, is the chair and the leader of that group. And I can really see the work and the thought they put into that. Much appreciated. Now we've got Women's History Month that's facing us in March, and I'm looking forward of what we're going to be doing and some of the things that we'll be learning for that month. So stay tuned. Let's do switch to COVID. It wouldn't be a Friday video without conversations around COVID, and I'm afraid that might go on for quite a while. Uh, do y'all realize that it is almost our 2-year anniversary that CARE South Carolina has been struggling during the pandemic, dealing with the COVID. The middle of March was when we really had to start taking drastic efforts. And I just want to take a few minutes to pause and to remind ourselves what an amazing, absolutely astonishing job that you at CARE South Carolina has done during this pandemic. Just a few things that I jotted down. Number one, CARE South Carolina was actually first to step out for testing. I don't know if y'all remember that. Remember in those first early months of COVID, there wasn't even a test available. We didn't know how to figure it out. And then finally, when testing and test became available, the Department of Health turned to us as their first partner. We did the first drive through testing event with partnership with DHEC and the National Guard and lots of other good partners at our St. David site in Society Hill in May. That was the very first event. And since then, we have been a testing partner throughout the PD. As a matter of fact, we've done 56,283 tests as of the end of last week. Let that sink in. 56,283. That is a lot of testing. I know organizations throughout the PD that are bigger than us that haven't done near that much testing or have limited testing to only their established patients. So amazing. Same thing in vaccines. We were one of the first to step out with vaccine availability as soon as we got our supply. And Moderna was our first supply. We were out there providing vaccines, promoting vaccines, making it available. We had a massive roll up your sleeves campaign for vaccination. And it must have worked because we've done 36,273 vaccines. I know it's dropped off in the last several weeks, but amazing what we did. Um, Vaccines that went out in our sites and our partners through our Mobies. It was phenomenal. Lots of people received their vaccinations through Care South Carolina. And then, of course, we've been a leader across the state and even for other FQHCs across the nation in our monoclonal antibody infusions. At the end of last week, we had done 8,632 of those. You know, that is very sobering when you stop to think about it. 8,632 monoclonal antibody infusions. That's 8,000 people that without that, they could have had very severe disease or even death. It was heartbreaking when we would get patients in too late that the monoclonal antibody infusion was too late to have an impact on. Heartbreaking. There were days when they were lined up outside in the cold, bringing their camping chairs, sitting out in that. It has been an amazing accomplishment of that. And on top of that, when the free testing kits came available, we stepped up. We've handed out thousands of free test kits and thousands of free N95 masks. You may think that every FQ across the nation or even across the state have done just as well. That is not the case. We have made it our priority to make sure that you, employees, had resources available to you, and that most importantly, so did our patients. And we've done a phenomenal job about it. And that's just scratching the surface. That's just what I could think of in the very few minutes I took to kind of reminisce about where we've been in this COVID pandemic. What we've been able to accomplish at Care South Carolina is really truly mind-boggling. Not many other organizations were up to that, but you were. You were, Care South Carolina. You were up for it, and you kept the needs of your patients and your community and yourselves, each other, at the foremost. You tackled a lot of difficult situations, and you did so always knowing that it was the health and the well-being of those that we serve that always were foremost. Speaking of COVID, what is happening? Well, I think by now almost everyone is aware of new guidelines that came out of CDC around masking. And you might be asking, what is that going to mean for Care South Carolina? We've scratched our heads over that because it does vary county to county. Because of that variation, uh, county to county, it depends on the level of community. I forget what CDC is calling it because it's not strictly transmission. CDC has done an index that includes not only cases but also hospitalizations and deaths, which I think is a very astute move on CDC's part because now case numbers really don't mean the same as they did several weeks and months ago because of the rapid at-home tests that aren't necessarily reported. So it does vary by county to county across our service area. So right now, Care South is literally not doing anything. We are going to keep our masking requirements in place for now. We have talked about it in both in our COVID task force and our CMO, Dr. Smith and I, and along with several others have talked about it. And we've taken a kind of a cautious wait and see attitude. And we're going to keep things as they are for now regarding this. And there are several reasons. One of them is what's on the way. There is what they're calling an Omicron stealth variant BA.2 that has been detected in the United States. And unfortunately, it is doubling the incidence of it at the rate of doubling every week. That's concerning us. The rapid at home test kits do detect it, but because the um, the variation is not well known about what it does, and it's also pretty difficult to track. There are some things about it which are concerning, some things that we don't know enough about yet. So it just seems to be a very wise decision to keep our masking, to keep our PPE precautions in place, the hand washing, the screening, all of that in place, and see where this is going to end up. It was pretty disheartening last time whenever we actually thought that during the spring last year that things were going to relax and we were going to have a little bit of break. And things did relax, even at Care South. Meetings got restored and so forth. And then Delta came along and whammed us. So we're being more cautious this time, and we're gonna see where some things end up and keep revisiting it. So just to let you know some of that, there are some things on our radar screen um, that we are well aware of that we have to consider. I don't know if folks realize, but right prior to the pandemic hitting in mid March for us, at the 1st of March, we only had 572 employees, and right now we've got 609. So we've had an awful lot of growth. A lot of that growth has created some very new or expanded services like our value based care division, like our growth and expansion in community health workers. And how could we forget the 5 new MOBIs that we have that were the result of grant opportunities and also donation from Care First Carolina? There's one thing I've always said about grants and new opportunities. With grants and with new opportunities comes a lot of accountability, a lot of compliance expectations, a lot of oversight and reporting. And I have to admit that that has been a lot more than we thought it would be. So we've got to step back and figure out and make sure that we can be accountable, that we can have compliance and oversight and are able to report and track what it is that we've said we do. So we've got some things on the horizon for that. There are things that have sort of been on hold over the last several months and couple of years. For example, the Joint Commission. Uh, Things have sort of been on hold for the Joint Commission, but as I've said before, they're coming, they're coming, they're coming. We have every reason to expect that that might be a face to face, live, unannounced survey. If it is, and we fully expect it to be, it will be a 4-day survey. And like I said, it won't be announced. We won't know when they're coming. We will know the morning that we can expect them because they make their announcement at 7:30, and Randy Carlisle is on it, and he'll let us know if they are indeed going to be in our shops on that Monday morning or Tuesday morning. Other things that are on our radar screen are coming back to some limited face-to-face meetings, some limited travel. There's been a massive HRSA and Bureau of Primary Health Care reorganization during this pandemic. What does that mean for us? And how will that impact our program and services? So, a lot on the horizon, a lot to be thinking about, and a lot to consideration as we get back to that that phrase that I frankly don't really like, but for lack of a better phrase, the new normal. We're going to be above and beyond normal. Care South Carolina has always been and set a pretty high bar for that. So stay tuned. I will keep you informed transparently as I have always promised to do during this pandemic. So before I close, you want to hear the quiz question? There's been some fun, some great winners, and I think we've finally got some of the kinks worked out. So here is the quiz question for today. True or false? There is a new Delta COVID-19 virus called BA.2 that is beginning to emerge, that is causing some close monitoring and some close watching. True or false? Respond to the email, which will be quiz.csc@caresouth-carolina.com with your true false answer to that. And have a good weekend. It's going to be a great weekend. Stay safe. There's still a virus out there. Bye-bye, y'all.